Dear distinguished participants, welcome to the third of the medical webinar series conducted by the Global Healthcare Travel Council and presented to you in cooperation with the nearest university. All webinar series are broadcasted live on the official YouTube channel of the nearest university and the Global Healthcare Travel Council. Our guests in today's webinar are Associate Professor Dr. DIDEM MULLAAZIZ and Assistant Professor Dr. BODAMYALIZADE. They will share with us their invaluable expertise on skin diseases and cosmetic dermatology journey in North Cyprus. Today's sessions will be moderated by Professor Dr. ASLI FERIDE KAPTANOGLU from the nearest university. Professor KAPTANOGLU.
Hello, everybody. I would like to thank to the Global Healthcare Travel Council for organizing this good webinar event. Today's topics are will be approach to skin diseases and cosmetic dermatology journey in North Cyprus, which will be presented by two distinguished speakers. Associate Professor Dr. DIDEM MULLAAZIZ and Assistant Professor Dr. PERTEVNIYAL BODAMYALIZADE, to whom which I had the chance to work with as well. Now, our first speaker will be Dr. DIDEM MULLAAZIZ. She will talk about approach to skin diseases. Dr. DIDEM MULLAAZIZ has completed her medical training in Trakia University, and then she completed her dermatology residency in Sparta University. And then after returning to Cyprus, she started to work as a consultant dermatologist in Near East University. She's been working there since 11 years. She had many research studies and wrote international papers about dermatology, especially focusing on dermatology and systemic diseases, and also in cosmetic dermatology. She has many international published papers and book chapters. I would like to present Dr. MULLAAZIZ to present her speech right now. Hello, DIDEM. We are listening to you now.
Hello, thank you. Good afternoon, everyone, and I would like to welcome you all to our online session. And I would like to thank the organizing committee for their kind invitation. And thank you, Dr. KAPTANOGLU, for your kind introduction. And today I want to talk about approach to skin disease. And can I start it? Yes. Cyprus is a sunny island almost all year, and the island can be considered a natural source of healing. For many dermatology patients, sunlight and the seawater have a therapeutic effect on many skin diseases, especially psoriasis and many forms of eczema. And as you know, the skin is our largest organ in our body, and the dermatology is a very comprehensive branch. And you can see here some of our disease names. I group them: allergic disease, inflammatory diseases, infective disease, benign skin lesions, premaline skin lesions, skin malignancies, nail and hair disease, sexually transmitted disease, pediatric disease, and drug reactions. At first, we will start with allergic skin disease. And you can see here allergic contact dermatitis. This is an eczema form. And sometimes we do the patch test. Patch test is a simple procedure for diagnosis the allergic contact dermatitis. And we try to identify the causative agents. We apply this test to the backside of the patient, and we open it after second day, and we evaluate it. And the third day, we give the results to the patients. If we see any redness and some skin changes on the allergy sites, we say the positive allergy for these allergen options. And another one, urticaria. We have a lot of patients in polyclinic with urticaria. And another allergic disease, atopic dermatitis. We have a lot of patients again, usually in childhood. And urticaria and atopic dermatitis patients, we can do the prick test. Again, we try to find what is the reason of this. In adult patients, we use forearm, flexor part of forearm, and in children, we can do the test for the to the upper back side. We drop some allergens to the forearm, and then we prick them with a sterile needle or a lancet, and we give the results in 20 minutes. Another group, inflammatory disease. At first, we will talk about acne patients. This is a very common dermatologic disease in our polyclinic. We have a lot of patients, and depending on the age of the patients, location, the lesions, and severity of the lesions, we can choose some treatment options. Sometimes we give medical treatments, topical or systemic form, and sometimes we use medical devices like IPL. And for the acne scars and active acne patients, we use chemical peelings and microneedling. For the acne scars, we do the dermatherapy. Another one, rosacea. This is a type of inflammatory disease. And again, we use some medical treatments, some devices, laser treatments for it. You can see here our clinic. This is the intense pulse light IPL treatment. We use the IPL for acne, rosacea, anti-aging for anti-aging, melasma treatment, all of them. Another one, psoriasis. It's a squamous changes. You can see here on scalp and the extensor parts of the body. Again, for the psoriasis, sometimes we choose medicals and sometimes we choose the phototherapy unit. And then lichen planus, you see here, skin lesions, nail involvements, and sometimes we see the scalp involvement for it. And we have the phototherapy unit in our clinic. We use phototherapy for psoriasis, dermatitis forms, vitiligo, and cutaneous T-cell lymphomas. We have two types, systemic PUA and the local form. Systemic PUA we choose for whole body lesions, and another one, if the patient has only hand and foot lesions, we choose this one. Infective skin disease, you can see here tinea infections, different locations, and sometimes nail involved we can see. You can see the types of them. And we use the treatments for onychomycosis, sometimes topical plus systemic, and sometimes we choose laser treatments. Another infectious disease, varicose, you can see here human papillomavirus infections, varicose papules everywhere, and we can treat varicose usually sometimes the topicals, and sometimes we use topical plus cryotherapy treatments. And this is molluscum, another viral skin disease. We can curettage them. Another one, herpes infections, herpes simplex virus. We can give the treatments for medical. Another one, again, the viral skin disease, zona. Again, we give the systemic antivirals in this patient group. And this is the infestation, scabies. We have a lot of patients in last 2 years, especially, and we give some mixtures and antiparasitic treatments. And then pediatric dermatologic disease. We have also the pediatric patients. You can see in the picture some of them, and we can trade it with pediatry together. And pruritus, this is a general symptom for us. We have some of them in dermatological disease, and sometimes we see this sign because of the systemic illness. We can do some tests and then we give the treatment. Pigmentation disease. At first, we will talk about melasma. This is a cosmetical problem for us, but we have a lot of patients in this patient group. We use, again, topicals, chemical peelings, cosmetic procedures, IPL treatments, mesotherapy, and PRP. And the vitiligo, we have this patient group, sometimes local parts and sometimes universal form. We can give, again, topical, systemic therapies, and phototherapy in this patient group. And sexually transmitted disease we have. One of them, syphilis. You can see a kind of specific dermatological signs, and all of the body, sometimes hair lesions we can see, oral mucosal part, and the genital area, we can give them treatment. Another sexually transmitted disease is again herpes and verruca. We can give them treatments for medical. And a large group, we have benign skin lesions. You can see the pictures, some of them. We can treat them. And the keloid and hypertrophic scars, again, we can give you some treatments like a cryotherapy, corticosteroid injections, intralesional. We can use silicone sheetings, laser therapies, and sometimes surgical removal we can do. And you see here some of the applications of us. One of them, cryotherapy. We use liquid nitrogen for freezing some of the lesions. You can see the long list here. We have a lot of skin lesions. We can treat it with cryotherapy. For example, warts, molluscum, keloid, pyogenic granuloma, skin tags, seborrheic keratosis, angiomatous lesions, and etc. We can freeze them every 2 weeks until we see the clearance. And another one, electrocoater. We usually use this machine for skin tags, molluscum, warts, all of the benign skin lesions. And this is a bloodless surgery method. We have a vascular laser in our clinic, NDIAC laser, and we can use some of the patients group of this device. For example, telangiectasias, angiomas, venous lakes, rosacea, and spider angiomas. And the important group of our dermatological disease is premaline skin lesions. For example, actinic keratosis, the Cyprus is very sunny island, and because of that, we have a lot of patients with premaline skin lesions, mostly actinic keratosis. And we can treat this patient group with cryotherapy usually, but sometimes at first we will take a biopsy, this lesional site, and we give the definitive diagnosis, and then we will start to the treatment. Again, actinic cheilitis, we have some patients like this, especially in lower lips. Again, we take a biopsy at first and then we will treat it. And sometimes we see the leukoplaky, again, the mucosal parts, and we treat it topicals and sometimes cryotherapy again. Another premaline lesions is Bowen's disease. It's a premaline lesion for squamous cell carcinoma. Again, we treat this patients group with usually plastic surgery. And some of our skin lesions, if we suspect the diagnosis, we use this method, definitive diagnostic method, skin biopsy. We have some different types of biopsy. One of them, shave biopsy, punch biopsy, incisional and excisional biopsies we can buy. And we have a lot of patients for follow-up their moles. You can see the types of moles here, nevus, and some of them atypical form, dysplastic form nevus. And at first we take photos and then we follow up, for example, every month, or if it's necessary, we can give a program for the patients, 3 months or 6 months intervals. And we have 2 types of device, manual form and the digital form dermatoscopies. The manual form, we usually use this one for examination. If we suspect of anything else, for example, if we see any risk for skin malignancy, we use the digital form dermatoscopy. We take photos all of the nevus and we save them. And for example, if we want to see the patient again 3 months later, we take again the same lesion photos, and we can compare that if we have any changes, for example, color, shapes, or any evaluations. And if we have any risk, if we see any changes, we talk with plastic surgery and we take biopsies there. And then if it's necessary, we excision the lesions. And sometimes we can do the mole mapping if the patient has history of skin cancer or family history of skin cancer, or if the patient has a lot of moles, for example, more than 100. We take photos of all of the bodies, the different locations, and then we mark one by one every moles, and then we check them every 3 months, for example. And we have a baseline visit photos, and then we compare them for every examine day. And if we see any changes, again, we talk with plastic surgery, and if it's necessary, we can excision them and send to the pathology for the definitive diagnosis. We have a lot of patients in this group. And we have some skin malignancies, most common form basal cell carcinoma, but rarely we see squamous cell carcinoma and melanoma. And if we suspect them, we usually prefer to send to the patient plastic surgery, and they can remove the lesions, and we send to the pathology again. You can see some pictures, basal cell carcinoma lesions, and another one squamous cell carcinoma. Rarely we see the melanoma patients. And lastly, we will talk about hair and nail disease. You can see here hair disease list. We have as scalp lesions, for example, psoriasis and seborrheic dermatitis. And we have 2 different alopecia group. One of them non-superficial form and another one superficial alopecia. If it's non-superficial alopecia, we try to regrow the hairs for this lesional part. But if it's superficial form, we only try to under control the disease. And you can see here male pattern alopecia, androgenetic alopecia, and alopecia areata here. We use mesotherapies for these alopecic patients, especially androgenetic alopecia and telogen effluvium. Hair mesotherapy is a treatment method which we apply injecting the vitamins, minerals, amino acids mixtures to the hair of the scalp. And another one, PRP. We can use the PRP again. PRP is we can choose again for androgenetic alopecia, telogen effluvium, and sometimes we choose the PRP for the hair regrowth after hair transplantation. We injected the PRP solutions to the scalp for the hair regrowth. And lastly, we will talk about nail disease. We have some patients with ingrown nail. We can give them topical and systemic antibacterial. If it's not effective, we can use some applications like a nail brace. And the last choice, we can do the nail surgery, proximal nail mastectomy for these patients. And thank you for listening to me.
Dr. DIDEM, thank you very much for this good presentation, including all the latest development and devices which we use in daily dermatologic practice, like is all over the world. You once showed again that the dermatology in North Cyprus serves as a center of excellence. Now we will continue with Dr. PERTEVNIYAL BODAMYALIZADE to give her speech on the cosmetic dermatology journey in North Cyprus. Dr. PERTEVNIYAL BODAMYALIZADE has completed her medical degree in the Ankara University School of Medicine, and she also did her residency in the same university in the Department of Dermatology and Venerology. After completing her residency, she came back to North Cyprus, and she started to work in Dr. Suat Günsel, Kayrani University, and she serves as the head of the dermatology department. She is a very well-known dermatology especially in the areas of cosmetic dermatology, dermatoscopy, and dermatologic surgery, as well as dermato-oncology. We see her now, I think she has joining us from a surgery session, I guess, with her surgical suites. Now we are listening to you, dear Nihal, for your presentation. Thank you very much.
Thank you very much for the nice introduction. I would like to thank the organizing committee for inviting me to this beautiful organization. My speech is about the cosmetic dermatology in North Cyprus. I would like to start my talk with introduction of North Cyprus especially. In North Cyprus, as Dr. Didem mentioned a few minutes ago, it's very sunny country. The Cyprus, you can visit the Great Inn Hall. You can see Kyrenia, beautiful boats, a mountain and sea view in Kyrenia. You can visit also Salamis ruins in Famagusta, the Five Mountains, and here in Omorfo you can see Vuni Palace and beautiful Karpaz view with the special donkeys there, and beautiful Golden Beach view here, and also beautiful Lefke. There are also lots of vineyards and grape production in our country. I'd like to continue about talking about the grapes a little bit here. You know, when they are fresh, the grapes are round shaped and they have fullness. And then later on, when they come into the shrinking process, they lose their volume. And then this is a little bit similar to our aging process. That's how I want to continue. And then comes to the word pitosis. We are losing our fat pads while we're aging, like similar to the grapes. In a youthful phase, when we're observing the anatomy, we can see the fat pads, like the grapes there, have fullness. By aging, we are losing this fullness, and by gravity also, they are shrinking, they're losing their volume, they're changing their places, they're getting downwards, and also the skin laxity is getting worse day by day. Also, this is the similar on the lower parts, like the bones, the orbital region. We can see this invertness of the maxillary bone, the nasal bone, the everts of the chin. This is happening on the all anatomical regions of the face. So we have got superficial fat pads, we have got deep facial fat pads, which we are trying to replace the lost volume while we're applying these cosmetic procedures to the patients. So what is happening day by day? While we're aging, while we're losing this volume, then comes this appearance of the tear tooth region. The orbital fat pads protrudes outwards. We can see the malar bag, the mid-facial group, and later on the nasolabial fold gets deeper. We're losing the volume of the cheek. It's coming downwards. We see the marionette line, and comes the jaw line later on, and we see the jaw here later on with the prejaw sulcus here. The aim is to find out the golden ratio again. It's not possible to have the face again completely symmetrical, but our eyes see beauty as symmetry. So if something is symmetrical, we say it is beautiful. So there are some golden ratios that we want to catch. What is happening while we're aging? On the skin, where we have got the skin tension lines. These skin tension lines are moving as we're moving our muscles of the face. We have got a very complex anatomy of the face, especially on the forehead area. We have got a frontalis muscle. When it is contracting, these forehead lines are appearing. When the orbicularis oculi muscle is contracting, it's a circular muscle which is contracting, and later on we can observe, after contraction, the crow's feet area. Later on we can observe the crow's feet on the cheek area also as well. And then when orbicularis oris muscle is contracting, we can see the smoker line area and a cellulitic chin, marionette lines, and so on. So what do we use? Especially, we are using the injectables. We are injectors, especially we are injecting on the skin, we are injecting on the subcutaneous tissue. Also, we are injecting inside the muscle. As you all know, we have got very popular agents. I would like to start with the neurotoxins. This is a very popular toxin. onabotulinum toxin, which we're using in our cosmetic practice in the polyclinic. Also, we can sometimes use abobotulinum toxin for some different purposes according to our. So, which area with these neurotoxins are shown here in this picture? About the frontalis muscle a few minutes ago, and the glabellar region, we inject musculus procerus, musculus corrugator. We inject the orbicularis oculi muscle to erase the crow's feet lines. We can also inject all these points to erase the cellulitic chin region. We can also use it for the neck region on the platysmal band to create the Nefertiti neck lift. I want to show you how we're making the injections here. We are always trying to be on the safe zone for ourselves as well as for our patients. We are injecting from the eye medial to the lateral region so as to avoid any diffusion, because all injection procedures also have side effects. So this is one of our injection techniques. The patient is sit up and we're injecting from medial to lateral region. In this patient was injected with the neurotoxin on the glabellar region in the middle of the face and for the forehead lines and also for the crow's feet region. This is 15 days later we effect after the procedure. So in 2 weeks time, we call the patients for the second follow-up visit and we are looking at the mimics again. This patient has a very nice, beautiful young face, but she needed a little bit injection to the forehead lines and for the glabellar lines. And before and after, while she's mimicking, you can see her face, how it's changing. Another, again, young patient, especially if your patient is at the young ages and if they start on the exact time, exact anatomic points are injected, then the results are perfectly better than according to the old patients. This patient has been injected again with the neurotoxin for the forehead lines and the glabellar lines, and 2 weeks later after the injection you can see half the patient is smiling here in the picture. Another patient, neurotoxin injection before and after. Sometimes if the patient does not start the treatment protocols early, then later on you can observe afterwards, especially about the glabellar lines they're talking about. We can combine some treatment protocols all together to erase these lines. But here in this patient, we only use the neurotoxin injection. Especially all our outpatient in our clinical practice, we have, yes, young, beautiful ladies, but male patients also are asking for wrinkle treatments and they want to make differences on their face. This young patient, male patient, has been treated with neurotoxins, the crow's feet, has got some crow's feet injection 2 weeks on the cheek area, but this is also. Another topic is the hyperhidrosis, where we use the neurotoxins. The patient for less sweating to us, and they are complaining about their t-shirts are always wet, the underarms are always wet. So what we're doing is to inject the neurotoxins onto this region again. First of all, we are detecting with the starch iodine test which areas are sweating more, and then we are injecting the neurotoxins on the underarm area. Another injection point, the indications for neurotoxins for the sweat treatment, we use it for the palms, also we can use it for the soles. We are combining neurotoxin treatments with dermal fillers. If your patient comes to you with the doctor, I want to lift my face up, if she's doing this movement always beyond the mirror, then it is a really good time for using fillers. And this slide shows us the injection points where we're injecting the fillers mostly. We can inject it to the temples, the nose region, the tear through area, the cheekbone, cheekbones, nasolabial folds, lip line, marionette lines. We can create jawline, we can create chin. Also, we can use it for the dorsum of the hands, over the hands. So we all know about the needles. So while we're injecting fillers, while we are trying to inject the deeper layers, like the deeper facial pet pads, or we are trying to put some volume over the bone, we have to go very, very deeply, and we have to move sometimes. With the needles, it's sometimes not very easy. So we all know that the needles are sharp, but sometimes we switch to the blunt cannulas. So this is an example how we're using the cannulas. You can see the needle, how sharp it is, but we are using these sharp needles to make a little opening on the surface of the skin to introduce the cannula underneath the skin. And this is a very nice picture which is clearly showing us that while you're injecting the temple, the cheekbone, and the nasolabial fold, in the same session, while you're taking the picture in the middle of the session, you can just directly observe this eyebrow on the right side is elevated, the corner of the right eye is elevated, cheekbone is lifted, the corner of the lip is lifted, and this is a very good example how you can create the volume at a session without too much bleeding, without making too many invasive surgery protocols. And this is immediately in the middle of the procedure, a taken picture, and after 1 month, after the swollen face is gone, after all the edema is gone, you can see better results also. Lip filling is a very popular nowadays also. We are injecting the vermilion border as well as we're injecting on the red area of the lips to create fullness. If we have an old patient, if the vermilion border, the lip line is erased, first of all we create the vermilion border, and then later on we put some more product inside the red area of the lips to create more fullness. So it's very important to respect to the anatomy. We always say we are not trying to make very fully Hollywood fashion lips to old patient or a very young working patient. So it's very important to respect to the anatomy, not using too many volumes at a time. There are some very important points to be on the safe zone. Another patient who has cheek augmentation here, this is an example of a cheek augmentation who had a filler injection on the cheekbone area and on the middle cheekbone area. Immediately after the procedure, you can observe that the nasolabial fold here is opening a little bit upwards, and the corner, the marionette line is, there is a correction immediately after the procedure. You can also give some volume to the chin area of the patients. Also, you can create jawline for especially male patients. It's very important. And there is a trick here when you are creating the chin augmentation. The patient later on has got a more volumized lip look afterwards the application. Let's move to chemical peelings, which we are using, again, very popular in our clinical practice. We are using it for treating acne scars, age spots, for aging skin. With a brush, we are using some different kind of chemical peeling products for different treatment, different applications. So before and after picture of an acne patient, which was very hard for us to treat. She was very young and she had severe acne, and we couldn't use any systemic treatments because she was very young, and she was refusing to take the tablets. So the only agent we could use is the chemical peeling. It took us a long time, but you can feel the difference of the before and after sessions with the chemical peeling treatment here. Another procedure is non-surgical thread lift. lifting. As it's said on its own name, we have got different threads which we're introducing underneath the skin, underneath the dermal area. There are threads also, and needles, and also cannulas which we are using. Here is an example of a thread, and there are PDO, polydeoxanone, as we are suturing in the surgery. We are using these also polydeoxanone sutures, and they are dissolving underneath the skin a few times later. And then there are some screw threads, and there are some mono threads, there are some cock threads, different types of threads in the clinical market. When we have so depressed nasolabial fold lines like these patient, then we can use these screw threads to, then these will be more effective for treating the nasolabial folds. This is an example of cock thread. Again, this is a cannula, a blunt cannula, and you use a needle to introduce this cannula underneath the skin, and then you introduce this polydeoxanone suture underneath the skin, and it is creating a lifting effect day by day. You can combine these treatments with botulinum toxin injections or filler injections. The best results are with the combination treatments also. With the cock threads, you can lift up the face immediately. When the procedure is complete, you can see definitely the results. We have got energy-based devices, as Dr. DIDEM mentioned a few minutes ago. We are using plasma energy, electroporation, and radiofrequency. Plasma energy is used to treat the skin tags also, and sagging skin treatments like upper eyelid. It's not a blepharoplasty, of course, but it was introduced as a non-surgical blepharoplasty. If the sagging skin on the upper eyelid is like this, and then the plasma energy is very effective. You can use it to remove this sagging skin. It's a sublimation method and not a burning method. And then comes the new eyelids healing. You can treat the solar spots also the seborrheic keratosis or skin tags, any benign skin condition with plasma energy. We have a skin diagnostic device also in our outpatient clinic, which is this one with the tablet form. It is producing some kind of lights like daylight, parallel polarized light, cross polarized light, true UV mode, and Boots mode, and it's taking the pictures of the patient's face. The patient puts his or her head inside this device, and then the machine takes the pictures and produces these lights. With parallel polarization mode, we can observe the early signs of aging, like fine lines and wrinkles, the pore structures. With the UV mode, you can see the gland distribution, skin type, the sun damage signs, the freckles, glioasma. With cross polarization mode, you can see the redness, the rosacea, the inflammations and pigmentations. With the Woods light mode, you can see the active sebaceous glands of the underneath the skin. This is another example. We have mesotherapy treatments also in our clinical practice. This is an example of dermapen, and this is an example of derma roller. Sometimes the patients buy themselves these derma rollers, but the small needle sizes. We are using generally this dermapen, or there are mesogun type of, like gun type of devices that we are doing these treatments. This is an acne scar patient who refers to our clinic, and after mesotherapy and PRP, platelet-rich plasma treatment protocols, there is a good improvement on the acne scars of her face. And also from front view, you can observe that the skin laxity is getting better and better, and there is a lifting up of the nasolabial folds and the corners of the mouth. You can observe it. Also, the acne scars seen. With radiofrequency treatments, before and after 4 sessions, we can erase the wrinkles of the neck. Also, you can use it on the face. After the 6 sessions, this is a treatment protocol which we're using heat procedures. We can use the mesotherapy treatment with dermapen for hair, with the hair loss treatment, with androgenetic alopecia patients and telogen effluvium patients. We can combine this treatment with radiofrequency, also while we are adding some vitamins and amino acids to produce the hair regrowth. Together with platelet-rich plasma injections, we collect blood from the patients and separate it from the white cells from the blood cells. And then afterwards, we see the results before and after combination with the mesotherapy treatments. With androgenetic alopecia patients, we have got very nice results. This is a telogen effluvium patient. Again, a combination treatment gives better results, as I mentioned before. This might be probably 10 sessions later, the treatment protocols are completed. Intense pulse light treatment therapy treats a range of skin pigmentation and blood vessel issues on face, neck, and hands and chest. We can treat acne, we can treat telangiectasias, we can treat some pigmentation like freckles with intense pulse light. We have got an opportunity about treating the hair to remove the hair on the whichever area you can imagine of the skin. We have got NDIAC laser in our clinic, or all we are using for this condition. And also, lastly, this is not a cosmetic procedure, but I would like to add this, as Dr. DIDEM mentioned a few minutes ago. We are treating the basal cell carcinomas with surgery, she said. And this is an example of before and after. This is a very good cosmetic result also. The pathology comes with basal cell carcinoma in this patient. You can see that there is lots of solar damage signs, lots of freckles on the skin, and this is a reason why these skin cancers are appearing on the skin. Thank you for your listening. We are in Kyrenia, and thank you very much.
Dr. PERTEVNIYAL, thank you very much for your nice presentation. It was a very impressive one, including your own cases with before and after excellent results. I would like to thank to all the speakers and all the audience for their joining to us webinar. And now I think Dr. Mustafa will make a closing speech.
Thank you very much. I would like to express our deepest gratitude for our moderator, Professor Dr. FERIDE KAPTANOGLU, and our distinguished speakers, Associate Professor Dr. DIDEM MULLAAZIZ and Assistant Professor Dr. PERTEVNIYAL BODAMYALIZADE for their valuable contributions in today's webinar. Our next event will be held on 30th of November. The topics of discussion will be Sustainable Development Goals with emphasis on 3 pillars: health, tourism, and social pillar. Thank you very much for being with us today, and hope to meeting you again in our upcoming webinar on 30th of November. Until then, I wish you good and healthy days.